I'm Nancy, and I am your host, and I am basically just going to say thank you so much to our two volunteers, Sabrina Moore, who is a long-term LVT for Colonial Veterinary Hospital. For those of you who are not locals, that is the largest single practice outside of Cornell University, which is also in our neck of the woods. And my dog's all-time favorite veterinarian, Dr. Kathy Hughes. So I will turn it over to them because they're the ones who are in the know.
Well, I think I'm going to start this off with the what's in news in vet med. And I think Kathy's going to round out with why take or when do you take your pet to the ER. So as Nancy said, my name's Sabrina Moore. I'm a licensed veterinary technician. This will be my 19th year in the profession. I have worked in small practices from 1 doctor practices to 4 doctor practices to now a 17 doctor specialty practice in Ithaca. My current role there is the technical manager. So I supervise and manage all the technical staff within the hospital. And I'm here today to talk about some of the changes I've seen in veterinary medicine and some of the things to expect when you do take your pet to the hospital or you feel like you are in need of emergency care. One thing I'd like to start out with is that I truly believe that over the last 3 years with COVID has helped accelerate a change within veterinary medicine that I think has been coming along a little bit slowly, but now I think with COVID, it accelerated that. That change, in my opinion, is a separation of services between wellness practice and emergency specialty care. As we all know, GP, and I'm going to use GP a lot in those. And what I mean by that is general practice, your wellness, your vaccines, your basic, simple, urgent care, ear infections, skin stuff. But I think over the last decade, or when I first started in this profession, I think every veterinary hospital that or clinic that I ever worked at, they did almost everything themselves. They saw their own emergencies, they fit them in. And I think as veterinary medicine has evolved, that has changed. I think more specialties are out there, more opportunities, more options for clients are available. And I think that the pandemic just accelerated that. With the pandemic, pet adoptions have increased drastically over the last 3 years. What that has done is it's filled your GP facilities or GP clinics. Their time is truly gobbled up with wellness vaccine appointments, limiting their ability to manage ER issues. I did a little bit of research in the last couple of days, just to get some numbers and to really solidify and to back what I was feeling about the change that I'm seeing. When I researched how many veterinarians there are in the United States, there are less than 48,000 licensed veterinarians in the United States. That's veterinarians that, I didn't break it down into what they're doing, but that's veterinarians from doing small animal, cats and dogs, to large animal, to research, to academia. So that's 48,000. That was a lot less than I thought. When I did another research on how many cats and dogs, so companion animals that are within the home, we're not talking about strays, that number exceeds 135 million cats and dogs in households. Do basic math, there's not enough veterinarians for the number of companion animals that are in everybody's home. Compound that with high turnovers in veterinary medicine. Your average client service rep in veterinary medicine, the turnover is about 50% in 2 years. Technicians, it's 20%, and doctors, it's 17%. What that's doing is leaving a shortage of veterinary professionals available to care for your animals, especially in an emergency situation. Your general practice doctors they have their hands full. They're doing the absolute best that they can. They're catering to clients that have been there longer, that they have a good working relationship with. They're getting clients in as fast as possible. There just isn't enough hours in the day to service all the animals that are out there. On top of all of that, veterinary medicine, the veterinary medical profession is also in the top 5 professions with the highest suicide rate. And I say that because if you take nothing away from this lecture, short of when to take your pet to the ER, I ask you to be kind and be patient. It's a profession that is taxed to the limit. It has been, and COVID just made it worse. We thought it was going to be a sprint. It's a multi-year marathon that's not getting any better. And until we replenish the workforce, there will be more animals than there are us to care for them. So one of the things going into emergencies, I can't express the importance enough to have a good working relationship with your general practice doctor. What that means is having at least an annual exam, if not a biannual exam. Have your veterinarians know who you are. The chances of them being able to being willing to answer the phone out of hours or give you medical advice over the phone without having you bring your pet into their clinic is much higher if they know who you are, if they have a working relationship, if they have seen your pet more than once. Legally, veterinarians have to have a working relationship with you and your pet to be able to provide medical advice or care. If you have a good working relationship with a veterinarian, they may be able to provide you a prescription called into a local pharmacy for an ailment. I'm not running one off the top of my head at the moment, but if you don't have that good working relationship, it's going to be hard to find on a late night or on a weekend. In terms of what's available out there for veterinary emergency care, in our area alone, and I'm thinking essentially Finger Lakes and central New York, there has been a drastic decrease in ER services. Syracuse, Rochester, they've all decreased their hours primarily due to lack of staffing. They've decreased their services. I'm pretty sure Syracuse lost its critical care doctor. They've regained her. I think they got a new one. But with that, they lost their surgeon. I believe I hear rumor they're getting a part-time surgeon in there. Yay. Rochester cut hours, which is leaving driving hours beyond that. So you're looking at Albany, you're looking at Ithaca, you're looking south, you're looking at Pennsylvania, you're looking at New Jersey. In Ithaca, you have Cornell, you have VCA Colonial Animal Hospital. And I do find that a lot of times they're at capacity. And when I say at capacity, typically what that means is there's either not enough cages left, not enough staff, or the complexity of the cases has outstretched the capacity of the staff that they have. Oftentimes when clients call and they'll get an answer, we're at capacity, some of the questions I would be asking as a client is your ER service at capacity? Critical care or ICU, where pets are housed overnight and staff has to manage them overnight, they're going to be at capacity far sooner than an ER service that might be able to triage your pet, which means to assess them, might be able to manage an urgent care issue like a laceration, where they would be able to sedate them, suture them, and send them home in a few hours. Porcupine quills, that's an in and out urgent care procedure. But a lot of times when at capacity is being stated, it's that the critical care, the overnight ICU housing is at capacity. Most ER facilities run on I think nationwide, most ER facilities run on a walk-in basis. I think we find in this area, because people are driving so far and so many hours and they need to know which direction, literally to point their car, north, south, east, west, they're calling, which is nice. It's a nice little heads up, but you don't want to drive, because you don't want to drive 2 hours to Ithaca to find out nobody can see you, when you should drive 2 hours or 3 hours towards Albany or south. So a call towards an ER facility is a good idea. But part of the question should be, I know you may not be able to admit my patient as an inpatient, but can you at least assess, can you triage them? Can you treat on an outpatient basis? Can you do basic diagnostics? Sometimes vomiting and diarrhea doesn't need to be admitted. It just needs to have a little bit of blood work done and some sub-Q fluids. So these are some of the questions I would be asking if I was calling around for ER services. What to expect when you're going to an ER. Top foremost, expect a multi-hour wait if your pet is stable. Your pet should be assessed within the first couple of minutes arriving at any ER. Your pet should be then treated based on the severity of disease that they are presenting with. So if your pet has a lameness or has a hotspot or an infection or is vomiting and diarrhea, they're going to be seen, but the pet that walks in the door that's bleeding or is hit by a car or has a trauma, they're going to be seen first. It's very similar to a human ER. It may extend your wait. So if you walk in and they're telling you it's a 2 or 3 hour wait, that's their goal. But depending on what also walks in the door, that may get extended out. So again, be patient and be kind. They're working through cases as fast as they can. It takes time. Advice about an ER: before you have an ER or an emergency, have a plan. Know your pet, know what you're willing and what you're willing not to do. No judgment in that statement. But I think in my household, I have 3 dogs. They're at different stages in their life. What I may do for one dog, I might not do for the other. I might do the same for all 3. It depends on the situation, but every person is different. Every person has limitations or has limits to what they're willing to do. Know that, be firm with that, understand that there is no judgment. If you're walking into a situation and you're feeling judged, I'm sorry, that shouldn't be happening. And that's a ding on our profession if we're judging. It should be a judgment-free zone. It's an emotional situation and we should respect every decision that you make. Our job is to provide you with your options and support the decision that you ultimately decide to do. I hate to bring up money, but expect it to be expensive. Veterinary medicine is ever evolving, and especially on the ER level, when you're going to a specialty service or a specialty facility, they have options. They have round the clock care often. That costs, there's a cost associated with that. They have equipment that potentially smaller practice don't have. Those have costs associated with that. They have specialists. They all have a cost to that. So expect it to be expensive. Have a plan for that. And I don't know of a hospital that doesn't expect payment at the time of service. Universities versus private ER facilities, the costs are pretty much the same. A lot of people think there may be a variation. I don't really think that there is. In terms of one of the things I thought about providing you guys information on is ballpark costs and for specific emergencies that you may encounter. Now, these are really geared for emergency facility pricing, not general practice, not small country style veterinary medicine, which totally has a place and I love it. I just don't think it happens as much as it used to. So ballpark emergency pricing, you have a dystocia, so you need to have a C-section. Ballpark, run of the mill, middle of the day, you're looking at low side 1,500, high side 3,500. Foreign body, GDV, bloat, you're looking 5,500 to 6,500. Hit by car can range. Stabilizing them, just assessing them, making certain you're getting x-rays, supporting them, starting out 3,500. If you have a hit by car that has, say, polytrauma, so multi-organ or multi-limb trauma, plan for 7,000 to 10,000 pretty easily. Pyometra, so this is for those that have intact females when you have an infection in the uterus, a good 25 to 3,000. if you have, I know this is mostly geared towards dogs, but one of the pretty common ER things we see is urinary obstructions in cats. Basic is going to be $1,800 to $2,500, and a workup. So you have a workup of an exam, blood work. You're coming into the ER because you're just feeling off. Easily $800 to $1,500. If you're in a situation, unfortunately, where you have to be out of hours or late hours, additional emergency fees will easily add $1,000 to $1,500 on top of the prices I kind of quoted. And these are ballpark. So every facility you go to is going to be a little bit different. Every case is going to be a little bit different, but this is just a general ballpark. Recently, in the last couple of years, they have come out with it. More and more things are hitting the market for telemed and online options. Because I do know that nowadays it is hard to get anybody on the phone, or what do you do when your general practice is closed at 5 or 6 o'clock? Who do you call? You can call an ER facility and you just don't know if you should go to the ER. You don't know what to do. The last couple of years, and I think this is possibly semi-related to COVID, more online and telemed options are available. I was able to find at least 3 that I thought were pretty reputable. Vettriage.com is one of them. I believe that was started by a Cornell grad. The pricing I could find on that was about $50 a session, no matter how long the session is. So it sounds like my dog's not doing super great. You call up, they're just not right. You talk to a professional, they guide you as to what you should do. Should you go to the hospital? Should you not? Could you wait? Askaveterinarianonline.com. I found that one, which seemed to have some high marks, but I couldn't find a cost for that. Justanswer.com was another veterinary telemed option, but it was more geared for a monthly subscription. And then the last kind of online telemed option I think every pet owner should probably be aware of is poison control. Whether it's the ASPCA poison control, and I believe there's another one. Anytime your pet eats something and you just don't know, but you know what they ate and you don't know if it needs to go to the hospital right away or can wait, call poison control. They will give you a case number. If you have that drug or the product or the potting soil or the poison or whatever it is in hand, they can help guide you what needs to happen. If they think, nope, you need to go to the ER, they will then be willing to talk to the veterinarian and guide them how best to treat your animal, whether it means supportive care for a day or 2 or specific testing. You would get a case number, you give that case number, and there's essentially a relationship between poison control and that veterinarian, and they have access to the specialists on poison control. There is a fee associated with that. It used to be like $65. I think I heard that it went up to about $85. Another service that's in our area and a little bit more towards Syracuse is Stillwater's. This is a home care hospice / home euthanasia service. They really deal with end of life care. They don't do general wellness stuff, but they do take very good pride, and they have a really good reputation, at least in this area, for their compassion, and they're willing to work with patients as long as necessary in hospice and then end of life services. Another thing in terms of finances that can be very challenging with veterinary medicine, and I do feel like this is getting better, is pet insurance. I feel like over the last few years, the number of veterinary pet insurance companies has just exploded. Used to be like 2 or 3, and now you search it and there's dozens of them. I highly recommend, if you have a young pet, especially with puppy, getting them started on pet insurance as young as possible. Research your pet insurance to make certain you find a policy. Most companies have different policies. Research what best fits your lifestyle, fits what you're looking for. I have seen very few policies that will cover annual exams, vaccines, and routine dentals. I did a little bit of research recently, like what's your top 5? And depending on which article you read, there's like everybody has a different top 5. I think a couple of people I know personally have the Healthy Paws, Trupanion, MetLife, ASPCA's out there, Embrace, Spot, Fetch, and the list kind of goes on. I feel like that veterinary medicine is going in that direction. I think equivalent to human insurance, if we truly knew the cost of human medicine, we wouldn't be as shocked at the cost of veterinary medicine. The equipment is essentially the same, the drugs are the same, but in veterinary medicine, we see it, we get it itemized, and we're holding that bag to pay that bill. But in human medicine, your insurance company is your mediator. They're the ones that are bargaining, they're the ones that are arguing the bills, and then you're just left with what's left. And my hope is that more insurance companies will be out there and more veterinary hospitals will work closely with them. It's the only way I think better pay for employees is going to happen is when hospitals are properly reimbursed for what they're doing and the true cost of veterinary medicine. And I'm not sure if Kathy's going to talk about this part, but financing options. I know that I said earlier, 9 times out of 10 payments going to be due at time of service. There are a couple of financing options out there. I know personally, one of the biggest one is care credit. A lot of people can actually use care credit for their own health, whether it's dental or vision, but it's huge in veterinary medicine. And I think Kathy was telling me about something called scratch and vet billing, but I'll let her kind of expand on that. And I think that is really my portion of kind of an update on veterinary medicine. I think in 2023 post-pandemic is that it's emotional. It's when you have an emergency, everybody is worried and everything is emotional. But please be kind and be patient with your veterinary professionals. They're doing what they can do. Ask questions. Email's a good one for a lot of hospitals. But really have a good relationship with your GP practice, I think, is a starting point, because that can often lead you in the right direction where you need to go. I think that's it for me, Nancy.
So Sabrina, there was a question and a couple of comments. One question is, are there parts of the country where the vets shortage is particularly bad or worse than others? Do you know?
I don't know as I can speak to that. I can speak to support staff. There are only 4 states in the United States that require licensure for veterinary technicians. New York State is one of them. I think other states, they do grandfather in or they title people as technician and they learn on the job, but it doesn't equal, it doesn't provide, I'm trying to find the right word. Nursing care, you find one nurse in one state to another state, they're all going to have the same background. Veterinary medicine, it's not that. The standards aren't the same. My hope is someday veterinary medicine, the standards will be the same from education of support staff. I don't know, as I had access to data about shortages around other parts of the hospital. I know that there's a difference in quality of supportive care, or support staff, because technicians in Texas may not have the same education as another state that requires a degree and a licensed exam that I had to take. Right. Leaving some of those tasks more to the doctors, whereas in New York State, technicians can do a certain amount of technical skills that in other states doctors are doing for themselves.
Got it. Somebody comment that they have used, I've forgotten the name of the first online or virtual consulting type of practice. Somebody said that she's used them a couple of times and has had great experiences. Somebody else mentioned that Dr. Otis from Stillwater is amazing, and I had to comment that I have had my dogs insured with Healthy Paws since they were puppies, and it has been really just a godsend, because that takes the financial aspect of any decision-making off the table. I would pay out of pocket for my pets, and it makes it just so much easier in terms of making any decision about their care, because I don't have to think about the cost. Really,
And,
that's
and I
not a factor.
I would tell you that that's probably 50% of the stress when dealing with an emergency on the veterinary side is you're presenting them a client with an estimate that is expensive, and there's no two ways about that. It's expensive, and your heart goes out to somebody who truly can't afford it, and they're pushed into a situation that nobody wants to be pushed into. When we hear that they have insurance, the conversation becomes a little bit easier, because their decisions aren't made by this emotional, you have emotions of my pet is dying or my pet is very sick, and then the emotions of how do I feed my kids, and how do I make that choice. When somebody comes in with insurance, you know that how the conversation is going to be a little bit different. It's going to be a little bit softer, it's going to be a little bit easier, and it gives a little bit of, I don't want to say freedom to the doctor, but every doctor comes out of veterinary school and they want to give platinum standard medicine. The reality is platinum standard medicine is enormously expensive, and they've got to come up, but they're not trained to give lower tier options. They want to do what they were trained to do, which is save it at any cost. The problem is it costs.
Right. Yeah, when I was 2-3 summers ago when my boy bloated, when I was on the road in between trials, I called the so-called local emergency hospital, which was an hour and 10-15 minutes away. And I told him I think he was bloating and I had insurance. And it kind of sort of felt like my reception was totally different because I said he's insured. And that might have been my imagination, but there was almost an audible sigh of relief.
I can guarantee you that that's probably exactly what happened, from whether it's clients, right from client services to the doctor to the technician, because you have a doctor that's sitting there going, wow, I have a really big estimate. How is this going to be received? What emotion am I then going to have to shift over to switching off of taking care of this pet to then taking care of an owner? Right. And client services, they take the brunt of it. They take the worst of the worst. And how many times in my career have I been told, you don't really care about animals, you're just in it for the money? That's why veterinary medicine has such a high turnover rate, is because you're dealing with emotion and trauma. Right. And trying to balance it both. The doctors, we're not trained to deal with the human side, we're trained to deal with the animal side. Right. But you can't negate the human bond, the human animal bond there too.
Go ahead.
I was reading this comments, the third telemed site. I think I mentioned it was justanswer.com. That one had like a monthly subscription of, I want to say it was like $30 a month. Again, I didn't reach out to them to really understand exactly what they were offering for that. I've heard, again, a lot of good stuff about the vet triage one. So I haven't personally had to use them myself, but there's more out there than there were, I think, even a couple of years ago.
Chewy also now has a vet consulting option. So FYI.
I think there has to be more options out there with the lack of veterinary emergency care. I think even Vestal had an urgent care facility that essentially closed down. Fairmont had an urgent care that closed down 2 years ago. I think Auburn opened up an urgent care, but their hours are relatively limited. There's just a limitation of options. So I think the next best is this telemed option.
Yeah, for sure.
Better than nothing.
Yes, I would agree with that. Yep. Well, that was great, Sabrina. Thank you. I think that was an excellent overview. I turned my camera off because there was a little delay and lag in a few times, and I wanted to try and smooth that out. So I guess we're moving on to Dr. Kathy Hughes, my Red Dog's all-time favorite vet, and he does not like vets.
It's all the cookies I give him.
Whatever it takes.
There you go. So hey everybody, thanks for hanging out, and we'll move into some kind of nuts and bolts veterinary medicine sort of stuff. Um, I've been in practice for a long time. I graduated from vet school in 1981 and been in continuous practice pretty much the whole time. So no time off for good behavior for me, I'm afraid. Uh, Obviously, we're a dog training club, so this is going to be focusing on emergencies with your dogs. But if you've got questions about your kitties, I'm up for that too. I think, gosh, I think Sabrina did a fabulous job covering a lot of the kinds of things that we worry about in practice. So I'm going to kind of concentrate on more the medical aspect of things. The first thing I wanted to mention that I think is important is to know your breed. A lot of us in the club have purebred dogs. Even if you don't have a purebred dog, you kind of should have an idea of what's really something that I need to worry about with my dog. Nancy mentioned having a bloat, and that's anytime I hear of those types of symptoms of distended abdomen, pain, non-productive vomiting or retching in a large breed, deep-chested dog, I worry about bloat. That's on the top of my list. If I get that exact same history and it's a beagle, I figure, oh boy, somebody left the cat food open and the beagle ate all the cat food. And now we got an unhappy dog that just is over distended with food. So it's a whole different thing. I think it's also really, really important to know what's normal for your dogs and learn how to do vital signs. If you can take their temperature, get their heart rate or pulse, get a respiratory rate, take a look at their gums. Are they nice and pink? That sort of thing. It can really, really help determine if you've got some kind of a critical problem going on. And also if you're talking to a veterinarian, they're going to want to know that information. You know, does he have a fever? Are his gums pink? What's his hydration like? So these are things that are not very hard to learn. And it's really, really important to know that information. This isn't a first aid talk, but it's really a great idea to have a first aid kit somewhere that you can put your hands on. Basic supplies. It's really nice to have a thermometer that actually works. Digital thermometers are wonderful, but their batteries get tired after a while. So make sure you have a working thermometer. You want some lube to help that thermometer go where it needs to go, right? Bandage materials are nice to have in a first aid kit with some scissors, pair of clippers. If you've got a furry dog, it's nice to be able to clip away like a wound or laceration. Some kind of basic scrub like Hibiclens and some saline solution to help flush things out. And it's really, really, really good to have a Elizabethan collar, the old cone of shame, right? It's good to have one of those that actually fits your dog, because you can save yourself a lot of hassle and worry by just putting that on the dog until you can get to the vet, so that they don't continue to chew their foot or rub their porcupine quills or rub at their sore eye or whatever. People don't love those, dogs don't love those, but man, they're a really, really good thing to have available. So I think that's an important thing to have in your emergency kit. You should also have a list of the medications that your dog takes, because when you're panicking and worried and scared, you're not going to remember. And that's an important thing to know to whoever's treating your dog, what medications they take, dosage, how frequent, all that sort of thing. It's also good to have in that same kit contact information, both for the poison control things that Sabrina was talking about, the ASPCA poison control and the poison pet helpline are the two that we use. So you can get in touch with them right away without having to scramble to look for that info. And also some contact information for emergency hospitals that hopefully are within an hour to 3 hour drive. And again, from the earlier part of the talk, it's nice to have some options, because you may be doing some driving to find someone that can care for your pet. I will reemphasize what Sabrina said: have a good relationship with a veterinarian. The last thing you want to do is to be shopping for a vet when your dog has just been hit by a car. So have a good relationship with your vet. Make sure you're nice to them, pay your bills. That's always a good thing, right? And that way, if you do have a big problem, you'll get quicker help, and hopefully you'll get easier help than if you're kind of doing cold calling, trying to find somebody to help you with an emergency. So moving on to emergencies, I've got some categories of emergencies that I think of. Pretty much 3 of them. The first one being a life-threatening emergency. The second being not a life-threatening emergency, but something that you don't want to wait. So it's probably not going to kill your pet, but you don't want to wait until tomorrow to get that taken care of. And then the situations, which sometimes look like emergencies, but they really aren't, where if you just use a little common sense and a little first aid, you're going to be okay and get you through the next 12 or 24 hours until your vet opens in the morning, and then you can hopefully get in to see them and have that taken care of. So for the rest of this, my part of the presentation, I'm just going to talk about, just some situations that we commonly see. It's not an inclusive list. We could go on for a week about that for sure. But things that, things that we see, stuff that makes, a lot of sense. And you're like, oh yeah, of course, that's an emergency. Other things, it's like, oh, I never thought of that. So hopefully we'll get through this okay. First thing I think of is some kind of a severe trauma. Hit by car is unfortunately still pretty common. Anything that, falls, any kind of, sometimes dogs are in cars that have accidents, gunshot wounds, all kinds of horrible things happen to them. Obviously, with those kinds of things, you need to have that pet seen, and the sooner the better. One thing that a lot of people don't think about is especially if you have a small dog, and your small dog is attacked by a big dog, and a lot of times, there might just be 1 or 2 little puncture wounds. Doesn't look all that impressive. Little dog looks okay, and some of those little dogs, they want to mix it up with the big dogs. They have that Napoleon complex, right? But unfortunately, sometimes they have terrible trauma underneath the skin. They'll have severe damage to underlying tissues, which can cause a lot of problems further on. They can have punctures into the thoracic cavity, so now they can't breathe normally. They can have punctures into the abdomen where infection or trauma can set in. So anytime I have a small dog that's been bitten or attacked by some large, powerful breed, you can fill in whatever large, powerful breed you want to there. You want that dog to be seen for sure. Poisoning, I think Sabrina did a good job talking about poisoning. Dogs eat stupid things all the time. They eat rat poison, they eat raisins, they eat grapes, they eat all kinds of things that they shouldn't eat. So most of those kinds of things, starting off with a phone call to poison control, get your case number, call your vet, and go from there. Comes a lot of things that are environmental types of emergencies. Certainly we worry about those. House fires, we see burns, we see smoke inhalation. Dogs get into situations where they're drowning or have near drowning types of issues. Electrocution happens, puppies will chew electrical cords. Some adult dogs never grow out of that. And sometimes all they end up with is a kind of a burn on the roof of their mouth. Unfortunately, sometimes they don't, and they end up having severe damage from that, which and the dog actually affects the lungs and they can't breathe. So those kinds of things are always a big problem. Heat stroke in the summer, right? Our temperatures are getting warmer. We like to do stuff with our dogs, and our dogs don't have enough sense to slow down sometimes when when it's too hot. So heat stroke happens, and you go from a panting dog to heat exhaustion to collapse. You don't want that to happen, obviously. So those are things to watch out for as well. Looking at the cardiovascular system, if you've got a patient that is a cardiac patient that maybe has congestive heart failure, we see that a lot in our older dogs. And they're pretty, I shouldn't say easy, but a lot of them are managed quite well, and they live wonderful lives with some medications. And they, have a normal amount of energy and their appetites are good. And if you see a patient that's been well controlled and stable, and all of a sudden that congestive heart failure patient is starting to do a lot of coughing, they're real lethargic, looking at their respiratory rate. You know, I always tell my owners of patients that are cardiac patients, get to know what your dog's resting respiratory rate is. And that sounds fancy. All it is it's counting the number of breaths your dog takes in a minute when they're resting. Most normal dogs, somewhere between 15 and about 25. If they're just hanging out, they've eaten their dinner, they're just watching you, they're not sleeping, they're not running around. And if you've got a cardiac patient and suddenly that resting respiratory rate is now 60 and the dog is just sitting there watching you, that's often a very early sign that you're getting into congestive heart failure that's decompensating from where it was before. So that's something, again, that needs immediate attention. Talked about a distended and painful abdomen with non-productive vomiting, and that's, you know, bloat is like the emergency. You know, it's the one that everybody with big dogs worries about, and it's a good emergency to worry about because it's something that, you know, needs immediate care. Without immediate care, most of these dogs die, and they die a pretty ugly, painful death. So definitely be looking for that with your big dogs, big deep chested dogs for sure. If you suspect your dog has a bowel obstruction, so dogs eat stupid things, right? And if you know they've eaten something dumb, that's really helpful. Sometimes we don't know that. If they're vomiting, having a lot of maybe diarrhea, if they're really lethargic, if their abdomens are painful, the sicker they are, the more urgent things are. And people think that it's really easy to diagnose these bowel obstructions, and it is not. It is a very difficult diagnosis to make many times, unless you're lucky enough that the dog's eaten something that's going to show up on the X-ray, like, you know, some big old chunk of metal of some sort, or something that doesn't have the same look on an X-ray that the rest of the inside of the dog looks like. So sometimes they're a little difficult to diagnose. But what can happen with a bowel obstruction fairly quickly in some cases is the bowel becomes dead or necrotic in areas and starts to leak. And now you've got peritonitis and septic shock. And before you know it, you're down a road that you can't come back from. So if you suspect bowel obstruction, that's really important to get looked at. Looking in the urogenital type of area, a male dog with straining to urinate. If I have a history of that happening, two things I think about right away. If he's an intact male dog, I worry that he's got a prostate issue going on. That's probably not an emergency. The other thing that can be an emergency though, is if he's got bladder stones. Male dogs have a bone in their penis that lets the urethra pass through, but it's not very good at letting bladder stones pass through. So if they've got bladder stones and those get lodged in that area, then they can't urinate. And any dog that can't urinate for not that long a period of time, less than a day usually, gets into some serious problems with kidney failure. They're super uncomfortable, nothing more painful, I think, than a urinary obstruction. And again, that's something that needs to be relieved right away. For female dogs, obviously, if you've got an intact female, you're going to want to worry about infection, pyometra. And there's two presentations for pyometra, one of which is called an open pyometra, which means they're draining yucky stuff. Usually looks like tomato soup, can look different, but if they're having a drainage from the vaginal area, and it's about 1 to 2 weeks, up to about 2 months after they finish their heat cycle, that's pretty high up on my list. There's an old veterinary saying that says, never let the sun set on a pyometra. And it's really true. They get really sick and really toxic. The ones that aren't draining get sicker and more toxic really quick. And again, untreated, they often die from this. A lot of people would like you to treat those with antibiotics. That sometimes works, but not usually, and it usually isn't a long-term solution. So they usually need surgery, and they need it right away. For whelping bitches, dystocia is something that we don't see real often anymore, but our practice doesn't see a lot of breeders either. Generally, my rule for dystocia is more than an hour between puppies delivered, or more than about 20 to 30 minutes of non-productive contractions and pushing. Some dogs have a different pattern when they whelp. And if your dog's had puppies before, they may deliver 4 or 5 puppies, take a breast, and then go back and deliver the rest of their litter. So there's nothing that's really ironclad in those rules, but just sort of a couple little guidelines there. Looking at the central nervous system, kind of wrapping up these urgent emergencies. If your dog is suddenly paralyzed, that usually is something that requires a pretty much immediate care, especially if it's a dachshund and they're very prone to disc disease, or certainly if it's from some type of a trauma or an accident. If you think you might go forward with surgery if your dog has disc disease, you have a way better chance of fixing that back if you do the surgery sooner rather than waiting 2 or 3 or 4 days for them to be dragging their back legs around, hoping that it's going to get better by itself. Seizures are another thing that are really concerning. And if we have seizures that either last longer than about 5 minutes, and that's the actual grand mal, convulsing, frothing at the mouth, urinating, defecating, the whole scary situation. If that lasts longer than about 5 minutes, then you're getting to a point where severe damage is being done to the body by that seizure activity. And it turns into something called status epilepticus, which means that they're having a seizure and they have absolutely no intention of stopping having that seizure. And that needs medical intervention. The other thing that also needs medical intervention is what's called cluster seizures. And those seizures occur when you've got more than 2 or 3 over a 24-hour period. Most of the dogs I see with cluster seizures will have dozens of them. They'll have one come out of the seizure, half an hour later, right back into a seizure. Same thing, they need to have, if they're already diagnosed as an epileptic, they need to have their medications adjusted and they need emergency care to stop that seizure activity. So those are most of the things I can think of that are commonly seen, that are fairly, situations where these are life-threatening types of issues, and there's not much doubt that they need to be dealt with. Some non-life-threatening, but really kind of things that require same-day care or urgent care. Looking at your dog's eyes, any kind of injury to the eye where there's pain, there's a lot of squinting, they're light sensitive, so photophobia. If the globe ruptures or if it's bulging, if you've got acute blindness, any of that sort of thing, again, not life-threatening, but eyes go bad in a hurry. And once you lose your vision, it's really hard to get it back. So that's something that you want to get seen as quick as you can. And again, know your breed. If it's a pug or maybe some other dog that has little bulgy eyes like that, you're going to be a lot more concerned than if it's, say, a collie like we have that have wee little tiny eyes that are set deep in their head. It's pretty hard to get a corneal ulcer in a collie. It's pretty hard not to get a corneal ulcer in a pug. So those are the kinds of things that, knowing your breed can really help a lot. If you have a dog that's vomiting a lot, more than maybe, 5 or 10 times in a row, their stomach is super upset by something or other, now there's blood in the vomit, that's something that you want to have evaluated fairly quickly, because you can be looking at some type of either stomach ulcer or perforation, something that could really lead down the road to some severe problems. The same thing with diarrhea. It's not that uncommon to see a little blood in the diarrhea, especially with a colitis type of a problem. But if you're seeing large amounts of blood and diarrhea, the dog is uncomfortable, lethargic, really acting sick, then that's much more of a concern. If he's got a fever, of more than 104. So normal for temperature for most dogs is somewhere between 100 and about 102.5. It depends if it's a hot day outside, if the dog's been running around, if what the activity is. But if they're just sitting there and they're sick and they've got a fever, if they've got swollen joints, super depressed, those are things that are concerning. And again, life-threatening, hard to say, but could be. So have them take a look at any unexplained bruising or bleeding. Nosebleeds are no fun to deal with in dogs. And usually they don't happen spontaneously, like sometimes they do in people. Usually there's some type of a bleeding disorder or toxicity as an underlying issue. So you're going to want to get that looked at for sure. Bruising in dogs looks a lot like bruising in us. With a dog with a heavy coat, you might not be able to really appreciate that, but you can sometimes see it on the inside of the mouth or on their stomach in that area. So that's something that if your dog is developing bruises and you don't have a good explanation, like the other dog plowed into him in the backyard and knocked him over, if there's just these random bruises, then certainly a worry there. If your dog's diabetic, certainly with a diabetic dog, if they're well regulated and then they're not, definitely want to have that checked out. If they're sick, if they're refusing to eat, if they're real lethargic, if they're running a fever, diabetes can be challenged to deal with on a good day. And when these guys, again, when they get sick, sometimes they go downhill pretty quick. So you don't want to let that go. And then one thing that I'd had kind of forgotten about, and Sabrina reminded me about, is porcupine quills. I used to practice in Philadelphia. We didn't have any porcupines in Philadelphia. I came up here and somebody, my second day on the job, somebody said, "Oh, we got a PPQ coming in." And I thought to myself, what the hell is that? And I learned about porcupine quills. So gosh, you got to feel so bad for these guys. Life-threatening, not usually. Uncomfortable, big time. Sometimes they have hundreds of quills, sometimes just a few. Really hard to pull out by yourself. You can try it if you got one or two quills, but if you break them off, then you have more of a problem. The other thing about porcupine quills that's really, really frightening is that they like to migrate. They like to migrate through the tissue planes. Sometimes they end up places that they shouldn't end up. I had one that a dog lost its vision because a quill migrated into its eye. I've seen dogs die because quills migrate into their lungs and cause bleeding into the lungs and associated types of issues. And that kind of thing can happen weeks to months to even years after the encounter with the porcupine. So certainly porcupine quills aren't to be taken lightly, and we want to try to get them all out as quick as we can. That's when your Elizabethan collar is going to come in handy. Throw that on your dog so he doesn't break more of them off on your way to the vet. So, and then just this last category, excuse me, hang on, of things that can wait until tomorrow. Water here. So some of these things are somewhat uncomfortable for the dog or very uncomfortable for the dog. And they can be an emergency just because you don't want your dog to wait. And I get that. I totally get that. I'm the worst when it comes to having my dogs be uncomfortable. So, but if you are, someplace where you don't have emergencies availability, or certainly financially, if that's not something that you want to take on, some of these things you can do a little bit of patching up in first aid, and you can get them through the night. Something as simple as a bad ear infection. They can be super miserable with bad ear infections, but just try to very gently clean out any debris. If you've got any kind of anti-inflammatory meds that you've used for your dog in the past, that might be a good time to get one of those into them, to just try to make them a little bit more comfortable. The same thing if suddenly you've got a lot of eye discharge, not necessarily the kind of presentation where there's pain and squinting, but just more gunk in the eyes than usual, and you've got some saline solution. By all means, try to rinse the eyes out, keep them clean, see if there's something in the eye, some type of foreign object or whatever that you might be able to rinse out with some saline solution. And again, you don't want to let eyes go, so I would definitely have that looked at the next day. Any kind of oral problems, loose teeth, fractured teeth, that sort of a thing. Those are not necessarily emergencies, and a lot of dogs that have loose teeth have had periodontal problems for a long time, and eventually the poor teeth sort of give up the ghost. Sometimes they are loose and they get stuck in a strange position, and it makes it hard for the dog to function. So, but generally not something you need to rush them right into the vet. If you've got some coughing, sneezing, wheezing, respiratory types of symptoms, but the dog seems fine otherwise, and you've learned how to do your vital signs, and your dog doesn't have a fever, and his respiratory rate's okay, try not to panic about that. One thing I get a lot of emergency calls about is reverse sneezing. Some of you may know what that is, some of you may not. It's basically the dog's attempt to clear their throat from postnasal drip, and some of them will do it with excitement. People always think their dog is gagging or choking or can't breathe or whatever. If you go on YouTube and just put in reverse sneeze, there's a really, really great example. There's two of them. There's a beagle and there's a pug doing reverse sneezing. So take a look at that, and you can reassure yourself that it's not the end of the world. And those guys don't even need to go to the vet. Just it's one of those things that, okay, he does that when he's nervous or excited or during allergy season. Skin issues, there's not too many emergency skin issues, but the dogs are pretty uncomfortable. Again, you might need to put your Elizabethan collar on to keep them from chewing that hot spot that they've chewed in their back end, to try to keep that from getting worse. You can do basic first aid on that sort of thing, gentle cleaning, cool compresses, a little bit of topical antibiotic if the skin is bare. Please don't rub gooey ointments into fur. All that does is make it more gooey and more it sticks to everything, and it makes it harder for us to clean that up for you and get that under control. You can have little wounds or draining abscesses, anal sac abscesses. They love to do that on Sunday nights, it seems. So, again, just basic first aid, clean them up, get them comfortable as you can. Non-steroidal anti-inflammatories, if you have some of those at home, can help make those guys a lot more comfortable. Something that really is kind of a little controversial would be a simple fracture. So your dog goes flying off the back deck and comes down hard, and you hear a big yip and the leg comes up. It's like, oh no, what happened? And you can see that there's swelling, maybe on the toe or maybe further up, a little bit further up the leg. But the dog seems fine otherwise. You can just put him in a cage, get him quiet, give him a little bit of something for pain if you have something for pain at home. Again, a non-steroidal anti-inflammatory, 1 dose of that. If you take him to the emergency hospital with that, that's probably what they're going to do until they come in the morning. Now, this isn't like, okay, the bone's broken in half and it's sticking out of the leg. That's a whole different story. But something like a broken toe or some minor fracture can wait until the next day. Bloody urine. Gosh, bloody urine is always scary, right? Especially for snow in the winter. I get all these phone calls. Oh my God, the dog's got bloody urine. It's probably had bloody urine for 3 or 4 weeks, but they only noticed it because now there's blood in the snow. Again, they're uncomfortable with that. It means there's some problem that needs to get assessed, not generally an emergency. If they have a seizure, just one seizure, if they've never had a seizure before, or certainly if they have a history of epilepsy or seizure disorder, sometimes dogs have seizures, and one seizure is okay as long as they wake up and they do okay. Not a need to rush them right into the vet. One thing I do see a lot of is vestibular symptoms, so the loss of balance. People always think their dogs are having a stroke. It's not a stroke. We don't think dogs really have strokes, but what can happen, especially in old dogs, is something goes awry in the balance center in the inner ear, and your dog goes from being normal to having a severe head tilt, vomiting, nystagmus, which means that the eyes are moving back and forth rapidly. Sometimes they can't stand up. These guys, they just need some time. They just need a little bit of time to sort of get back to what might be their new normal. It's good to get them checked out to see if there's some kind of serious ear disease or something that could be causing that. But again, it looks frightening, but it's something that can generally wait until the next day. And then any type of lameness, unless the bone is sticking out of the skin, lameness usually is not an emergency. Lots of things can cause lameness, and can be anything from Lyme disease to just a soft tissue or a muscle injury. So again, just usually for most of these kinds of things, simple common sense first aid and kind of doing the best you can to get them comfortable and quiet I think you're ahead of the game usually that way. And then I guess the last category is just a sort of call for advice category, which, it's like you just don't know. Sabrina was giving you some information on a couple different folks to call, which I think really makes good sense to have that availability. Our practice, when we're not there, we've got something called Guardian Vets that answers phones for us. And there's a licensed veterinary technician that helps people decide, do you really have an emergency or is this something that can wait? So, things like bee stings or hives, any kind of allergic type of reaction on a dog that's just fine. Is that something that can wait? Can I give them some Benadryl? That sort of thing. Same thing with like a swelling someplace that just popped up or that you just noticed. As long as the dog is content and happy, not some reason that you have to rush right into with that. So those are the kinds of things, and there's a million of those. But don't ever hesitate if you can, if you're concerned about your pet, to make those phone calls to get some advice. And even though I'm telling you bloody urine is not an emergency, if it's an emergency for you, by all means, take your dog to the vet and get that seen as quickly as possible. The only other thing I wanted to add at the end here, which I think sometimes causes more problem than it's worth, is, of course, the first thing that people do when their pet has a problem is they get on the internet, they go to Dr. Google and try to figure out what's going on, and they collect lots and lots and lots of information, some of which is good and much of which is not so good. There is a website, it's called Veterinary Partner, and it's run by the veterinary, it's VIN, which is a veterinary information network that a lot of us will consult for information if we have tough cases, lets us communicate with other veterinarians and specialists and experts. And they have a website, which is veterinarypartner.vin.com, which has a lot of different articles on different types of problems and places that you can go to get information. And that's good information written by professionals. And you're not getting some kind of crazy thing like, let's put apple cider in the little kitten's eyeballs. I had one of those, unfortunately, about 2 months ago, that they read that was a good idea to do with a cat that had a lot of eye discharge, and that kitten has no eyes right now because they just managed to destroy its eyes by putting vinegar in its eyes. So yeah, so be careful about that. So that's probably about all I've got, and it looks like I've talked long enough anyway. Happy to answer any questions out there. We have to wake Nancy up first.
I'm here. I just muted myself
There you go.
because I had dogs moving about.
No way.
Yeah. So it says more and more folks are having dogs get into marijuana, edibles, discarded joints, etc. Is this always an emergency, or is it dose dependent?
My experience so far is it's been dose dependent. I've seen a couple of them. Some of the dogs are really affected and remain affected for 24, 36 hours and require almost life support hospitalization. And that's generally if they've eaten a large amount of those types of products. Sometimes they're just a little drunk and goofy, sort of like the people that bring them in. And in that case, you can get by with just good nursing care. But I think we're going to be seeing a lot more of that too because of the legalization now.
One thing which would be good on that topic, and I'm so glad somebody brought that, is common symptoms of that is they stumble, they kind of look like they're out of it, they're dribbling urine, their body temperature might be a little bit low, they generally look stoned, their behavior is stoned. But the big thing is like they're dribbling urine. A dog dribbling urine and kind of stumbling into the office, 9 times out of 10, we look at the dog and know from across the room it got into THC.
Yeah.
Again, it's not a judgment. If that happens, tell your doctors, because you don't want them chasing something else when that's something relatively simple. And like Kathy said, it can be dose dependent on how bad it is. But the treatment is essentially the same, supportive care to get them till they're not so stoned. But be honest. Totally, nobody's gonna call the cops on you if your dog got into drugs. They just need to know what to treat your dog for.
Yeah, amen to that.
You, Sabrina, you made an excellent comment in the chat, which was it can be helpful to get any repeated odd behavior on video. You can always send it to your GP vet and or bring it to the ER visit. I think that's an excellent, excellent idea. That's great.
Yeah, I'm always asking folks when they, well, my dog was doing blah, 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 but now of course he's bouncing around the exam room. And if they can pull out a video of whatever behavior was going on or symptoms or whatever, it can really, really help clarify things quickly.
Anything else, folks? Here's in the category of know your breed comment. My heart would sink if I see one of my Rotties limping. Cancer is a problem. In my breed, first Rottie started limping and it was osteosarc. Yeah, and that can hit any dog at any age.
Yeah, we definitely see more of those types of issues in large and giant breeds, but I've seen, unfortunately, bone cancer pretty much all across the board. But hopefully that's not what's causing lameness in 95% of the dogs that I see anyway. Most of the time it's either Lyme disease, anaplasmosis. Those are our two favorite lameness causers that aren't trauma related, or just, again, they get all the aches and pains that we do as we get older. So
Question: if you don't have insurance, how much should you have in a dog emergency fund?
Yeah.
I think I'll field this one, Kathy. I think.
Go for it.
I think that's a personal decision on what you feel you're willing to go. How far are you willing to go? A fracture repair is easily a $5,000 to $6,000. I mean, planned for $5,000. Most emergency surgeries, $5,000 to $6,500. I mean, I think, what did we have today? I had a diaphragmatic hernia in the office. That estimate ended up $6,500 on a 1-year-old cat that they adopted in November.
Wow.
Like they're doing it, but like, do they have $6,500? I have no idea. How much are you willing to extend? I think that's where care credit, a lot of times, and again, Kathy, you may be able to expand on these two other things I mentioned, scratch and vet billing. I know we do a ton of business with care credit, and they have a lot of interest-free financing for 6 months, a year, depending on the amount and credit. But for me, I'd be thinking at least 5,000 to 6,000, and then still think, I mean, a major, I had a DKA, which was a diabetic ketoacidosis case. I had 2 of them in 1 week, and each of them were $10,000 cases.
Toka's bloat was 9K. It was about 8,900 something.
There are so many things that factor into how that money gets spent. Like the surgery may only be the diaphragmatic hernia today. That surgery may only be $3,000 for the surgery, anesthesia, and care. But if that cat needs oxygen support and higher level hospitalization and 2 or 3 days in hospital, it gets higher. A forearm body, easily $5,000 to $6,000. If it's complicated, if they've perforated, if they're septic, $10,000, because it's a week-long stay in the hospital. I mean, my gut would tell you $10,000. I don't have $10,000, but in my emergency fund for the dogs, but that's my gut for super complicated. Polytrauma fractures. We had a dog this summer, broken back, pelvis, leg. It was 15 grand, and not including the follow-up appointments and care that we provided for that patient.
Yeah, it gets heart-stopping. I know the vet billing is something that our practice uses a lot of, and it's basically a contract which provides a client the ability to pay over. It's kind of like care credit. You pay over a certain amount of time, and there's, I guess, a soft credit check that goes into that to make sure that we can go forward with that. And then I think scratch pay, I'm not exactly sure what that is specifically, because I don't personally get involved in a lot of that part of the practice, but it has to do with estimating what the total bill is going to be. And then again, it's a credit, it's a off-site credit option that will cover costs for that. And then they make a contract with the owner. So, you know, there's stuff out there that can help people budget or help people pay for some of these large bills. But, you know, it's the bottom line is it's up to them to figure out how that they want to do that. So.
And some of these financing options you can, I know with Care Credit, and again, I'm not going to harp on Care Credit. It's just the one that I'm most familiar with. People can apply online before they even hit the door. If you're driving 2 hours, you can be applying online as you're driving, hopefully have somebody with you. You can do it on the phone. You can do it when you get to the practice. You can do it online. However, it'll give you an idea of what they're allotting to loan you. And then you know what else you either have to make up, or you know you're going in going, this is my budget. This is what I can do, and what can I do with what I have. I think somebody wrote in here about mushrooms. That's also can be a poison control conversation. If you can identify the mushroom, or you can narrow it down, talking to poison control can help guide the veterinary professionals how best to treat them, because they can be toxic.
Any other questions or comments, folks? Otherwise, we'll let Kathy and Sabrina get on with their evening. This was fantastic, guys. We really, really appreciate it.
Well, good. I hope that I've given some folks a little food for thought there, and maybe helped ease your mind about emergency care. And I really appreciate Sabrina's work trying to, you know, let us know how the veterinary profession is working these days as far as emergencies. So it was fun talking. Thanks for having me, guys.
Thank you so much.
Thanks
Have a
again.
good night, guys. Thank
Take
you.
care.
Good night.
See ya.